specifically, Biana, it's not a monolithic community. You're going to have, disparate points of view, although they have been pretty lockstep in terms of their overall concerns, specifically with regard to vaccines. There have been other things that I think they're more supportive of, the concerns about food supply, for example, the concerns about toxins in the food supply, the fact that we spend $4.5 trillion on healthcare in the United States and have some of the worst outcomes in the developed world. So those are things that I think people have recognized for a long time are a real concern, and the idea that maybe things could be done about that, I think that has much more support. But the vaccine issue is a flashpoint, and for many people, it's also a metaphor for, I think, how RFK approaches science in general. He has these beliefs that don't seem to be rooted in science, and he seems to have a disdain at times for the scientists who talk about these things, and I think that's their primary concern.
Yes, especially because he himself is not a scientist, so he doesn't come with the years of education and the field work and expertise that they do. He claims that he has never been anti-vaccine, but he spread false claims about vaccines for years over social media. As you know, in the past, he said vaccines had caused a Holocaust. He's made the comparisons and the links, obviously, between autism and I wonder if you could just set the record straight for us, for Americans who are now worried, will I be able to take my kids in for their annual vaccine shots? Will a newborn be receiving the vaccines that they've been accustomed to for so many decades now? What, if anything, changes with someone like him at the helm of such a large and influential organization like the HHS?
Well, I think the most honest answer is I don't know. I don't think anybody knows, because his stance, seemingly his language, changes sometimes not just day to day, but even within the same interview. As you just point out, he says he's not anti-vax, but says the vaccines have caused a sort of Holocaust. He has said that he would not take away people's vaccines, but also tells a story of walking up to a mother with a young child while he's out on a hike and making sure to convey to that mom that their child should not be vaccinated. So I don't know what that translates to ultimately. And look, I think, just to be a little bit optimistic, I think it's very hard to take away vaccines or make them unavailable for people. And pretty clearly, they've had a significant beneficial impact. I mean, some of these studies, again, are studies that he will see. But if you look at, for example, children who were vaccinated over the last 30 years, from 1994 to 2023, you have these projections in terms of the impact. 500 million illnesses prevented, 32 million hospitalizations prevented, 1 million deaths prevented. And this is data that I'm sure he has seen and will certainly be presented again if he is in a position of power at HHS. So I think some of that data is hard to argue with. The vaccines and autism issue, Biana, I think, again, is the real flashpoint. And as you probably know, I mean, this started in the late 90s with a paper that was subsequently retracted, but it was a paper of 12 children who developed autism who had also had the MMR vaccine. And the authors of the paper, the author Andrew Wakefield, made this cause and effect sort of relationship between the vaccines and autism. Again, the paper was subsequently retracted. It was found that the cause and effect relationship was not found to hold up. And it inspired lots of studies after that, and big studies following hundreds of thousands of children, some who've been vaccinated, some who've not been vaccinated, and basically saying, okay, let's follow these children for 15 years and see what happens. And what they found was that there was no relationship between the vaccines and autism. Those studies were subsequently replicated. And that's why, we arrived at this position in the medical community that we're still not sure what causes autism, but it's very clear that vaccines do not. I should also point out, just because I'm a neuroscientist, that neuroimaging has improved over the last 25 years. So we now see changes in the brains of very young children, even within the womb. Certainly before they've been vaccinated, we see autism-related changes in the brain. So we know that something's happening much earlier than vaccines would even be given. Again, we don't know what those things are. Could be some environmental influence, but these are important data points. And again, studies that he has seen, and still despite that, just as recently as a few months ago, he says, I believe vaccines cause autism. He said that specifically. That's a disdain not only for the science, but I think for the messengers who created that science, and he might be in charge of many of them if he's in this position.